Welcome to Cortex Conversations. Today, we're diving deep into an incredibly promising intersection, how artificial intelligence and machine learning are fundamentally reshaping the landscape of epilepsy care.
Yeah, it's a really exciting area.
And this isn't just about small tweaks. We're really talking about the potential for, more accurate diagnoses, truly personalized treatment strategies, and maybe even proactive management for the over 50 million people worldwide living with this complex neurological disorder.
Exactly. And we got a fascinating array of information to explore today. We'll be looking at how this ability of machines to learn and problem solve, what we generally call AI, is being applied to the very intricate challenges of epilepsy.
Okay.
Our sources give us a pretty detailed picture, actually. The current state of the tech in epilepsy care, its capabilities, which are exciting, but also, the areas where we still need more work.
Right.
So our aim today is to really unpack the most significant advances and, crucially, what they mean for patients and clinicians without getting totally bogged down in the technical weeds.
Okay, let's get right to it then. To really understand where AI is making a difference, I think we first need to appreciate just how complex epilepsy itself is.
Absolutely. That's fundamental. At its core, epilepsy is characterized by recurrent, unprovoked seizures. These stem from unusual electrical activity in the brain.
Okay.
But what makes it so challenging is the sheer variety. Seizures manifest in so many ways,
Yeah.
and the underlying causes. Equally diverse. We're talking genetics, differences in brain structure, metabolic issues, sometimes even the aftermath of trauma. It's a very heterogeneous condition.
And it's not just the physical seizures themselves, right? The impact on a person's life sounds pretty profound.
That's a crucial point. Our sources really emphasize the significant psychological and social hurdles. People with epilepsy often face stigma, limitations on daily activities, and sadly, an elevated risk of CDP, sudden unexpected death in epilepsy. That risk is particularly high for those whose seizures aren't well controlled.
Wow. It sounds like even just getting an accurate diagnosis can be a real hurdle sometimes.
It really can be. Distinguishing an actual epileptic seizure from other events that might look similar, things like psychogenic non-epileptic seizures, or even just a simple faint that can be tricky.
Right.
And the traditional tools, EEG, MRI, they're invaluable, of course.
Yeah.
But they have limitations, especially, capturing brain activity between seizures when things might look completely normal.
Yeah, that makes sense.
Plus, there's the fact that a significant portion of individuals, our material suggests around a third, don't get adequate relief from standard anti-seizure meds. So the need for alternative approaches is really pressing.
So, okay, against this backdrop of a really complex condition, this is where artificial intelligence and machine learning are stepping in. When we talk about AI, what are we really referring to in this context? Is it like the robots we see in movies?
Well, not quite like that usually. In essence, AI here is about equipping machines with the ability to simulate aspects of human intelligence reasoning, learning from data, making informed decisions. And what's fascinating, though, is that while AI in medicine isn't brand new, there were earlier sort of rule-based expert systems decades ago.
Right. I remember hearing about those.
Yeah, systems like MYCIN. But the advances we're seeing now, driven by machine learning and especially deep learning, offer a level of adaptability and sophistication those older systems just couldn't manage.
Right. Those older programs felt very much like just following a strict flow chart. So what are the specific AI technologies that are really proving to be game changers in epilepsy care today?
Okay, the key ones our sources highlight are machine learning, or ML, deep learning, DL, natural language processing, NLP, and maybe a bit less directly, robotic process automation, RPA.
Let's start with ML.
Right, machine learning. Think of it as computers learning from data without being explicitly programmed for every single step. Algorithms analyze vast amounts of information, identify hidden patterns, and then use those patterns to make predictions or classifications.
So finding things humans might miss in all that data.
Yes, exactly. In epilepsy, ML is being used in really crucial areas, like analyzing EEG data, those brainwave recordings to detect seizures, maybe even predict them. And also in developing personalized prediction models based on individual patient info.
Okay, so the machine teaches itself by looking at the data. And I guess the more data it sees, the better it gets.
Generally, yes, that's the principle. Larger, more diverse data sets usually allow these ML models to become more accurate and robust. They get better at recognizing the subtle nuances of seizure patterns across different people.
Makes sense.
But it's worth noting, even with smaller data sets, there are clever techniques, things like data augmentation, which is
Yeah.
sort of like showing the AI slightly tweaked versions of the data it already has to make it more resilient.
Ah, okay.
And transfer learning, where knowledge gained from one related task is applied to another, these can be really effective too.
That's smart. Okay, so that's ML, and then we have deep learning, DL. How does that build on ML?
Deep learning is, well, it's a more advanced subset of machine learning. It uses complex structures called deep neural networks. These are loosely inspired by how our own brains are structured.
Okay.
And these networks can process incredibly intricate, high-dimensional data. Think about the really detailed signals from EEG or the complex images from MRI and PET scans. That's where DL shines.
Right.
Within deep learning, we often talk about techniques like convolutional neural networks, CNNs. They're particularly good at recognizing spatial patterns, like finding the specific location of an abnormality in a brain scan.
Ah, okay. The where.
Exactly. And then there are recurrent neural networks, RNNs. They excel at understanding sequential data over time, so perfect for analyzing the continuous flow of EEG signals, the when and how things unfold electrically.
So CNNs are like the spatial detectives finding the spot, and RNNs are focused on the timeline of the brain's activity. That makes sense. Now, what about NLP and RPA? They sound a bit different.
They are, yeah. Natural language processing, NLP, that's all about enabling computers to understand and interpret human language.
Like reading notes?
Exactly. In healthcare, this means analyzing unstructured data doctors, clinical notes, electronic health records, even research papers. This can help spot trends in patient outcomes, figure out how people are responding to treatments, maybe even flag potential adverse events sooner.
Wow, okay.
It can also help with things like medical coding and documentation, sort of behind-the-scenes stuff.
And RPA?
Robotic process automation. This one's more about automating routine, rule-based administrative tasks. Things like scheduling appointments, managing billing, entering data.
So not directly clinical decision-making.
Right. While RPA doesn't directly diagnose or treat, by streamlining these processes, it can free up healthcare professionals' time, letting them focus more on direct patient care. So it's an indirect benefit, but potentially a significant one.
So RPA makes the whole system run smoother, which helps everyone. But the real power of AI in epilepsy seems to boil down to that core promise. More accurate detection, better prediction, and these truly personalized treatment plans.
That's the crux of it, yes. AI-driven seizure detection, analyzing EEG in real time for continuous monitoring, potentially alerting clinicians almost instantly. Machine learning algorithms going a step further, maybe predicting when a seizure is likely to occur, allowing for more proactive management, taking medication before a seizure, perhaps.
That would be incredible.
And then deep learning, really paving the way for personalized medicine, tailoring treatment approaches based on that unique mixed clinical history, genetics, past responses, moving us closer to finding the right treatment for the right person, much faster than the current trial and error.
Okay, let's dive deeper into diagnostics then. How is AI making a real, tangible difference in how we identify and understand epilepsy right now? Automated EEG analysis sounds like a big one.
It is a big one. Our sources detail how AI is really revolutionizing EEG analysis. It's significantly increasing both the speed and the accuracy of detecting those telltale seizure patterns in the brainwaves. As we mentioned, CNNs are great at spotting those spatial signatures in the waveforms. And there's another type of ML algorithm, support vector machines, SVMs. They're also very effective with this complex, high-dimensional EEG data. They're often good at avoiding overfitting, which is important in medicine. You don't want the model learning noise instead of real patterns.
Okay, avoiding overfitting. Good point.
The result is clinicians can now process far greater volumes of EEG data much more efficiently. This leads to quicker diagnoses and improved long-term monitoring. Think about reading days of EEG data. AI can really accelerate that review.
That speed and accuracy must be huge in critical situations.
Absolutely. And we even have specific AI systems mentioned in the material, like SparseNet and Score AI. What do these tell us about where we are with AI and EEG analysis?
Yeah, what about those?
Well, SparkNet, that stands for Seizure Prediction and Reliable Control Network, it's shown significant potential, predicting seizures with high sensitivity in controlled research settings.
Okay, prediction. That's the holy grail, almost.
It is. And Score AI standardized computer-based organized reporting of EEG that focuses more on bringing consistency and objectivity to how EEG findings are interpreted and reported across different hospitals or clinics.
So standardizing things.
Exactly. But it's important to manage expectations. While these systems show great promise, the performance of models like SparseNet can sometimes dip a bit when you move from clean research data to messy, real-world patient data.
The real world is always trickier.
Always. And while Score AI improves consistency, it's not perfect. It might occasionally flag something that looks like a seizure but isn't a false positive. So this just highlights the ongoing need for refinement for validation in actual clinical practice.
So like any tool, they're powerful aids, but not necessarily a complete replacement for human expertise yet.
Precisely. They augment the clinician, they don't replace them.
And how do we measure how well these AI tools are doing? I hear terms like sensitivity and specificity thrown around.
Those are absolutely crucial metrics, yes. Sensitivity tells us how good the AI model is at correctly identifying actual seizures. High sensitivity means it rarely misses a real seizure.
Okay, catches the real ones.
Right. Specificity measures how well the model avoids false alarms. High specificity means it rarely says there's a seizure when there isn't one.
Got it. Avoids crying wolf.
Exactly. Our sources suggest some advanced CNN models have achieved impressive results in controlled data sets. Sensitivity maybe 85–90%, specificity around 80–85%.
This sounds pretty good.
It is. But again, real-world data complexity, patient variability, these can cause those numbers to fluctuate.
Yeah.
SVM models, for instance, often show high sensitivity, but might struggle a bit more with specificity in really complex cases.
Okay. What about using AI for those detailed brain images? MRIs, PET scans?
Yeah, AI is proving incredibly valuable there too. Deep learning models, especially CNNs and something called autoencoders, are being trained to analyze these high-resolution images.
To find the source. Essentially, yes. To identify the specific brain regions where seizures are likely starting the epileptogenic zones. AI can detect subtle structural or metabolic abnormalities, things like hippocampal sclerosis or cortical dysplasia that might be really hard for the human eye to consistently spot.
So it offers a more objective look.
Potentially, yes. More objective and consistent assessments compared to relying only on a clinician's visual interpretation, which can be subjective.
And the accuracy rates for AI and imaging seem quite promising as well.
They do. Studies show AI models analyzing MRI data achieving diagnostic accuracy rates between 75% and 90%. In many cases, that's higher than manual interpretation alone.
Wow.
But, same caveat as before, performance heavily depends on having large, high-quality data sets for training. And things like variations in MRI scanner quality or the specific patient populations used for training can influence how well they work in different settings.
So if we put AI diagnostics side by side with the traditional ways, what's the main advantage? Is it just faster? Speed is part of it, but the real power seems to be in the synergy. Combining AI with traditional tools like EEG and MRI lets us use the strengths of both.
Okay.
AI brings that systematic analysis of huge data volumes, spotting subtle patterns. Clinicians bring their nuanced understanding of the individual patient, their history, the whole picture.
The human element.
Exactly. Our sources suggest AI-augmented EEG and imaging can lead to a significant boost in diagnostic sensitivity. Maybe a 20–30% improvement in seizure detection rates with AI-integrated EEG, for example.
That's substantial.
It really is.
Yeah.
Particularly helpful in complex cases, or maybe in areas with limited access to highly specialized neurologists. But we still need to tackle the challenges, making sure models work reliably across diverse populations and improving that interpretability so clinicians can trust and understand the AI's reasoning.
Yeah, that issue of interpretability, black box problem, that seems like a key limitation across AI diagnostics, doesn't it?
Absolutely. And it's linked to the need for those huge, diverse data sets, which are hard to gather consistently across different hospitals with different equipment and protocols.
Right.
And if clinicians don't understand why the AI is suggesting something, especially with complex deep learning models, it raises understandable questions about trust and, ultimately, accountability.
Who's responsible if it's wrong?
Precisely. And ensuring these models generalize, well, meaning they work reliably in different clinical settings and with different patient groups, that remains a big hurdle and an active area of research.
Okay, so AI is clearly making strides in diagnosis. But what about after the diagnosis? How is AI being used in the actual treatment and ongoing management of epilepsy?
Right, this is where we see that really exciting potential for truly personalized care. AI algorithms can analyze a massive amount of patient-specific data. We're talking genetics, seizure history, responses to past medications.
All of it.
Yeah, potentially. To predict which anti-seizure medication, or ASM, regimen is most likely to actually work for that specific individual.
Yeah. So cutting down on the trial and error.
Exactly. That often lengthy, frustrating process of trying different drugs, different doses, AI could help shorten that significantly.
And the sources give us some encouraging numbers on how accurate these predictive models might be.
They do. Some machine learning models, looking at genetics and clinical history, have shown accuracy rates around 70–80% in predicting how well a specific ASM might work for a patient.
That's pretty high.
It is promising, and this is but it's absolutely crucial to have robust regulatory oversight here. We need to ensure these tools are reliable, that they aren't biased by the data they were trained on, and that they're used responsibly by clinicians.
Which brings us neatly to regulatory guidelines. What are bodies like the FDA saying about using AI in epilepsy treatment? Are there rules in place?
Well, they're actively developing them. Regulatory agencies like the FDA are creating guidelines for AI and machine learning in healthcare generally, including for epilepsy applications. These guidelines tend to emphasize the need for solid evidence of safety and effectiveness. Transparency is also key. How does the model actually work?
Right. No black boxes.
Ideally, yes, or at least ways to understand the outputs. They also stress real-world validation, showing it works in actual clinical practice, not just in the lab, and continuous monitoring and updating of the models as new data comes in. For AI making treatment recommendations, the focus is heavily on patient safety and ensuring clinicians have the info they need to make the final call.
Okay. Now, we're also seeing AI play a role in more direct treatments, like responsive neurostimulation, RNS systems. How does AI enhance those?
RNS systems, like the NeuroPace system mentioned in our sources, are a fascinating example. These are implantable devices. They continuously monitor brain activity in a specific area.
Right, in the brain.
Yes. And they're designed to deliver targeted electrical stimulation directly to the seizure focus area as soon as abnormal activity starts, aiming to interrupt the seizure before it fully develops. The AI algorithms within the device are critical here. They analyze the incoming EEG data in real time, looking for the specific patterns that signal an impending seizure for that individual patient. That allows the device to intervene precisely when needed.
And have these RNS systems shown good results?
Yes, clinical studies have been quite positive. They've shown that RNS can lead to a significant reduction in seizure frequency for many patients with drug-resistant epilepsy. Some people see a 50% or even greater reduction.
That's life-changing for some people.
Absolutely. But the effectiveness can vary based on the individual seizure patterns, and the devices need careful programming and ongoing adjustments by specialists. The fact they have regulatory approval speaks to their demonstrated long-term safety and efficacy for the right patients.
Are there downsides? Cost, maybe?
Yes, cost and complexity are factors. They certainly impact accessibility. It's not a solution for everyone.
Okay. Beyond these implantables, AI is also being used more broadly to predict how patients will respond to different medications, right? Not just which one to start with.
Precisely. Given that many people don't get seizure control with the first or even second or third medication, AI models can analyze that mix, again, genetics, medical history, seizure characteristics, to estimate the likelihood of responding well to a specific ASM.
So it's part of that precision medicine push.
Exactly. Moving away from a one-size-fits-all approach towards treatments tailored to the individual's biology and clinical profile.
But trying to predict something that complex, an individual's response to a drug, there must be challenges.
Oh, absolutely. Data heterogeneity is a big one. We're dealing with varied types and sources of data genetic markers that differ across populations, inconsistencies in how clinical info is recorded.
Different hospitals do things differently.
Right, which makes it tough to build predictive models that work accurately for everyone. Plus, there's the constant need to validate and refine these models as new genetic discoveries are made and more clinical data comes in. And even variations in treatment protocols or drug formulations between institutions can add complexity.
It sounds like a continuous learning process for the AI and the researchers.
It really is.
Looking ahead then, what are some of the most promising future directions for AI and machine learning in epilepsy care? Where is this heading?
Our sources point to several exciting areas. One key focus is just continuing to improve the basics, accuracy and generalizability of the AI models, making them more adaptable to diverse patients and the unavoidable variations in data quality.
Right, making them work reliably everywhere.
Exactly. And related to that, more research into AI models that are inherently more transparent or explainable in their decision-making, that's crucial for building clinician trust.
We're also hearing a lot about closed-loop systems. What does that mean in this context?
Yes, closed-loop systems are a really innovative direction. Think of it as a system that not only detects a problem but automatically initiates a response.
Like the RNS, but maybe even more adaptive.
Potentially, yes. Systems that monitor brain activity in real time and, using AI analysis, deliver a targeted intervention. Maybe stimulation, maybe something else precisely when needed to prevent or stop a seizure, perhaps even adjusting the intervention based on the real-time feedback.
Wow, truly adaptive management.
As the AI gets more sophisticated, these could offer highly personalized, constantly adjusting epilepsy management. But there's still work to do on refining the algorithms for accuracy, ensuring reliability, and navigating the regulatory approvals.
And what about bringing AI together with other rapidly advancing fields like genomics and wearable tech?
That's another huge area of potential. Analyzing genetic information with AI could give us much deeper insights into someone's specific type of epilepsy, their risks, and their likely response to different treatments. More targeted therapies from the start.
Okay.
And wearable devices, smartwatches, other sensors, they offer continuous real-time data streams. AI algorithms could analyze data from these wearables to detect, maybe even predict seizures outside the clinic, alerting patients or caregivers.
So combining the genetic blueprint with real-world monitoring.
Exactly. Imagine combining that detailed genomic data with continuous monitoring from wearables. You could create incredibly comprehensive individual profiles, enabling truly proactive and responsive epilepsy management. That's a very exciting prospect.
Okay, let's try and unpack what this all means for you, our listeners. This deep dive into how AI and machine learning are being applied in epilepsy care, it really shows a field that's just brimming with potential.
It really is.
From analyzing those incredibly complex brainwave patterns in EEGs to potentially tailoring treatment plans down to the individual, AI is offering powerful new tools that could significantly enhance the lives of people living with epilepsy.
And here's where it gets really interesting, I think. While these advancements are genuinely remarkable, the journey is definitely not over. Continued research is vital, improving accuracy, ensuring reliability. And then there's the whole question of how best to integrate these powerful technologies into everyday clinical practice. That's crucial for actually realizing their full potential.
So what does this all mean in the end? Well, it points towards a future, maybe not too far off, where epilepsy diagnosis could be faster, more precise, where treatments are much more effectively matched to individual needs right from the start, and where proactive seizure management becomes less of a dream and more of a reality. It's a future filled with a lot more hope, I think, and the real promise of a better quality of life for millions.
And maybe here's a final provocative thought for you to consider. As AI and machine learning become even more deeply woven into how we manage complex neurological conditions like epilepsy, what entirely new possibilities might emerge? Things we haven't even really begun to imagine yet. It's an exciting frontier, no doubt, with the potential to really transform how we understand and treat this condition in some profound ways.